Thank you, Angeliki. Hello, everyone. I will present the evaluation of abortion surveillance system in Albania for the period 2014-2015. In Albania, before abortion was legalized, the maternal mortality rate was high, and almost half of it were due to illegal, unsafe abortions. In 1995, abortion law in Albania was approved, and based on this law, abortions can be performed on woman request up to the 12th week of the pregnancy and up to the 22nd week of pregnancy for other health reasons of woman or fetus. After the law was approved, all the abortions should be reported to the National Institute of Statistics, but the information that was sent to the National Institute of Statistics was poor, and not all the districts reported to it. So in 2007, the Institute of Public Health, with an order from the Ministry of Health, has started to establish the abortion surveillance system. The main document for reporting abortions in Albania is the abortion form. Some data regarding the period 2010-2015, we have observed a linear decline trend in abortion number, rate, and ratio, an increasingly higher trend of spontaneous abortion compared to induced abortions. There is a growing trend of abortions by women living in rural areas, and more than 92% of women obtaining abortions are reported as married. The main variables of the abortion form are regarding information about institution, the socio-demographic characteristics of women, regarding age, residence, marital status, education, employment and insurance status, the type of abortion, if it is an induced or spontaneous abortion, the reason, pregnancy history, previous pregnancies history of the woman, gestational age, method the doctor has used to perform abortion, and the classification code by ICD-9. There is no information in the abortion form regarding the contraceptive woman has used before. This is the flow of information regarding the reporting of the abortion form. So after an abortion is performed, the doctor is in charge to fill the abortion form, and then after all the abortion forms from public and private hospitals are reported to the hospital statistical office. There is a person in charge for reproductive health surveillance activities. He is the reproductive health inspector in each district, and they go to the hospital statistical office and take all the completed abortion forms and send these abortion forms to the National Institute of Public Health. Our National Institute is in charge to collect all the information from the districts, to analyze it, and to produce annual reports and send them to the Institute of Statistics and the Ministry of Health, and also to send feedback to local level. It was not done an evaluation of abortion surveillance system before, so our aim was to evaluate the abortion surveillance system during the period 2014-2015 in order to identify the gaps and weaknesses to be able to reduce the number of abortions and also to adapt the family planning programs. We followed the CDC guideline for evaluating public health surveillance systems. The reported data from 2014-2015 for public sector, we focused on this data, and we have compared the abortion forms that were reported to the National Institute of Statistics with the cases reported in abortion registers in every district. The attributes that were assessed were data quality by proportion of missing values for all the variables in the form, simplicity regarding the structure and ease of operation. 75 physicians were asked about the time to complete abortion, flexibility, so is able the form to adapt to new changes, acceptability regarding the proportion of individuals and institutions who participate in the surveillance, representativeness by proportion of reporting with the abortion form, and usefulness by able to detect trend over years. Regarding data quality, the overall completeness in the abortion form is 93.2% for the 2 years, and the completeness in 2015 is higher compared to 2014. The data quality completeness is calculated for 23 variables, for all the variables in the form. Regarding simplicity, the abortion form contains 2 pages, so there are 23 variables in total. All the 37 maternity wards report with abortion form. There is a person responsible for abortion surveillance activities. All public health district directories, they report to the National Institute of Statistics, all of them 100% in paper form and 61% in the electronic way. All the abortion forms are meeting the case definition, and the time for completing these forms from 95% of physicians is 2 to 5 minutes. In 2007, a new abortion form was adopted, and 5 fields were added in this form. So regarding the flexibility, this form can be adapted to new changes in case definition, reason, or method doctor used to perform abortion, because contains other fields that can specify. For example, the doctor can specify if it is another method he used to perform abortion. Is able to adapt to ICD-10 codes, because now we are operating with ICD-9 classification, but the ICD-10 classification is translated, and this form can easily accommodate the ICD-10 codes. Abortion surveillance system functions with the existing financial and human resources. Acceptability, all the maternity wards, 100% of them report abortions. All the public health directories report at the National Institute of Public Health. All public health specialists are involved in surveillance activities, and 100% is timely reporting so quarterly to the Institute of Public Health. The overall completeness for all the variables in the form is 93.2%, and the proportion of cases reported with the abortion form is 74%. In the 2 maps, we have presented the proportion of reporting with the abortion form, and it is calculated by regions and also at national level. And with the yellow color, you can see that this proportion is less than 50%. And then after the red color is 85 to 98%, and after that, so we can see there are regions with 99 to 100% of proportions reporting with the abortion form. So the overall representativeness for the 2 years is 74%, but it's higher in 2015 with 78.2%. And we can see differences between regions. Abortion surveillance system is able to detect the trend of abortion over years, and also to detect age-specific groups with high risk, for example, women living in rural areas. There are annual reports produced by the Institute of Public Health and sent to the district level and Ministry of Health, and easily can be combined with other data like births and fetal deaths, but still we have missing information on contraceptive methods human used. Also provide useful information to other organizations and researchers and policymakers. So this is the first evaluation of abortion surveillance system in Albania. 100% is the participation from all the maternity wards, the overall completeness of the form 93%, representativeness 74%, and we observe regional differences. Electronic reporting is 61%, and we can say that abortion surveillance system is rather simple, flexible, and provides timely data. Missing data is still from private sector, and still is not used, this data, in an integrated way, maybe for family planning programs. The limitation of our study, not directly able to estimate the accessibility and simplicity with a direct survey. Our recommendations, we need to maintain the data quality by implementing regular trainings and provide regular feedback at local level. We need to include the private sector in the reporting process through meetings and trainings, and to increase awareness of the physicians about the reporting of abortion by the form, and also to include the contraceptive use in the reporting form, and in order to increase the usefulness. Finally, I want to thank all the collaborators at the National Institute of Public Health and the supervisor, scientific coordinator for all the suggestions and guidance given. Thank you.
Thank you, Alba, for a nice presentation. I'd like to open the floor to questions. We have 5 minutes, please.
Nice presentation. Were there any differences in the induced and spontaneous abortions? Like you have done all the indicators for this surveillance system. Was there any data analysis done specific for this induced and spontaneous abortions?
I didn't understand.
Can you repeat the question? Can you repeat?
This difference in analysis between the induced and spontaneous abortions.
Yes.
That I would like to know, like how you covered that part.
How many? In the abortion form, we have a specific field. So the doctor can fill the form if it is an induced. Induced abortions are with woman request, and spontaneous abortion are spontaneous ones. So we have calculated by years the proportion of abortions induced and spontaneous abortion. And when we see the trend, it is a higher trend of spontaneous abortion compared to induced abortion. So you want to, why is this a higher trend of spontaneous?
No, I'm not. I'm just asking, was there any analysis done to see the surveillance gaps, that is stratification done on induced and spontaneous? That was not done. It was like whole put together, isn't it? Both induced and spontaneous.
Yeah, they're reporting both, induced and spontaneous, with the abortion form.
Okay. Was there any data triangulation done to check? You told already that it is missing data from the private sector, but still the data triangulation, like the sensitivity of the surveillance system.
Okay, from the since 2007, we have collected data on private sector. There were 12 private clinics that were reported to the National Institute of Public Health, but in 2013 there was an order from the Ministry of Health to close the private clinics and to give the license to the private hospitals. So for these 2 years we don't have data on private sector regarding the abortions. So we have focused the evaluation only for public sector in these 2 years. But now the private sector from 2016 has started to report to the National Institute of Public Health. So all of them need to report, public and private sector.
Thank you very much.
I think I gave the floor previously to... I'm sorry, I gave the floor previously to Nana, but yeah. No, it's okay. Nada, you can go ahead.
Okay. So
just a question, please.
Yes.
One question at a time, so we have all of us have the opportunity to. Sorry.
thank you very much. For your law issued in 1995 regarding abortion, is it a mandatory for any woman who asks to have abortion induced to have a consultation regarding family planning?
So
if a woman wants to have an abortion induced, is it compulsory for her to have also, following this abortion induced, a consultation on family planning?
Yes, of course.
Thank you very much and congratulations for a nice presentation. And it's very important to think about a number of abortions and to solve this problem. Start from evaluation what you have in your country. Because I have to give one question, I had more. I need to ask you if you collect information about mortality that is collected, that is related to abortion, and also I need to, if you have case definition for mortality that is related to abortion, to include cases in your registry system.
Maternal mortality, you mean due to abortions or not?
I use the same maternal mortality, but after how many days after it's maternal mortality related to male delivery, and abortion mortality that is arise after 44 days again, or clear definition I need if you have some kind of definition for.
So up to the 12 week on woman request, she can perform abortion for any reason if she doesn't want to follow the pregnancies up to the 12 week of the pregnancy.
No, question about not this. Question about mortality related to abortion.
Mortality. We don't have deaths from abortions due to abortions for the moment. Yeah, since for these last years we don't have.
Maybe it is not. Maybe it is not. You are sure, but it could be not registered.
Because we also take the data from the Ministry of Health regarding the maternal mortality, and they are not due to abortions.
Okay, this is very good. Thank you.
Yeah. Because before it was forbidden, it was not allowed to, the women were not allowed to perform abortions. And now, up to the 12th week of pregnancy, they can perform an abortion on request. So.
Hello.
Hi, thank you for your presentation. Very interesting results. I was wondering regarding the top reasons for abortion among the induced and whether there were any public health measures taken.
Yeah, if it is an induced abortions, main of them is on human request. The main reason, because they doesn't want or they don't have, for socio-economic reason, they cannot keep the baby. So up to the 12th week of pregnancy, and after that for medical reason, or for example for other fetus, congenital malformation of fetus, they can perform up to the 22nd week of pregnancy the abortion.
Yeah, Senate.
Just a short one. Thank you, Alba. Thank you very much. So our country is facing with the fact that some of the parents are conducting choriocentesis and other invasive procedures in order to get the sex of the child way ahead of the birth. And what we've realized is that there is a lot of parents who are doing the abortions if the fetus is of female sex. Mm-hmm. And that's unbelievably shameful. And last week we had a huge media campaign, beautiful effects. And do you have any data on whether is it the same situation in Albania?
We had a lot of discussions, and we have taken several meetings regarding if it is an abortion performed. Here in the abortion form, there is no data regarding the gender, if it is the fetus is female or male, but maybe before was a problem in Albania, but nowadays I think it is not a problem. The female babies are well accommodated in Albania, so there is not a problem. Yes.
Regarding your question, we have some data was done by London School of Hygiene and Medicine with Ariane Johnson in Albania, that we have this sex imbalance.
Yeah.
And the rate is around 111 to 100 in favor of males. Especially in urban area, maybe Alba didn't know this, in urban area are more favored to female, and rural area more favored in male. This is some data about this.
When we realized that we had a problem, the rate was something 105 over 100 in favor of males. So 111 over 100, it's, yeah, thank you.
Okay, just a quick question because we have no time left. Yeah, quick question, Visian.
I would like to know why you didn't include the data about family planning contraception in your form, since it could prevent voluntary.
Yeah, I have mentioned it because it is good to have data in the abortion form, but in the actual abortion form we don't have data about the contraceptive method women use. It's for that I have put it there in the main variables. So also I put it in the recommendations, so we need to include this, the family planning method women used. But also in the Institute of Public Health we have another program regarding the contraceptive use that overall in Albania, what are they using? And in overall Albania, it is a low use of modern contraceptive use. So most of them are using traditional methods.
Thank you, Alba. That was a great discussion going on. So in the interest of time, we have to stop here. Thank you again.
Thank you.